I am right now 54 years of age, and when I was first diagnosed with cancer, I was about 45.
Cancer, to put it in a simple form, is an uncontrolled growth of cells which are caused due to various issues. Cancer can also be referred to the term malignant, which means that the cells can either grow or spread throughout the body. The difference between malignant and benign tumors is that benign tumors don't grow. The growth aspect of cancer is precisely why it is so deadly. Also, the growth being of an uncontrolled nature, the growth can block certain pivotal parts of the body, such as the nasal cavity and the arteries. Also, cancer being able to spread to other parts of the body, it can grow and you won't even know it. For example, if you go into surgery and you cut off the tumor, and if even one cell of cancer is left in your body, it would grow and spread to other parts of the body as well. Cancer is a disease which still remains an enigma today, and rightly so. It is one of the few diseases which do not have a definitive treatment, let alone a cure. Why so, you ask? I'm here to explain just that. The word cancer has long roots going back to 370 BC. The word was first used in its Greek form by a doctor named Hippocrates, that is krakinos, which can be roughly translated into crab. This was so because when he saw the cut of a malignant tumor, the wound of the veins looked like a crab, hence the name. Later, a scientist named Celsus, who was also a doctor, translated the word krakinos to Latin, in which it meant cancer. Soon after, the term was coined. In those times, cancer had only two ways of treatment: amputation and purgatives. Amputation was chosen to be the better option as the survival rates were higher. Also, purgatives were not a well-tested option. These methods were introduced after 3 centuries of research through the method of dissection and were introduced by Wilhelm Fabry and Nicholas Tulp. These two methods were to be the only methods by which cancer could have been cured for the next 1000 years. In the late 1700s, scientists started to hypothesize and confirm why some types of cancers happen. A British surgeon named Pervicelli Plott and John Hill were the first one to hypothesize that tobacco or other substances such as soot could cause cancer in the lungs, nose, scrotum, etc. Cancer is mainly caused due to carcinogens. Carcinogens are materials present in natural and man-made forms that increase the likelihood of having cancer. One of the most infamous carcinogens, which is also the cause of 90% of lung cancer cases and 20% of all cancer cases, tobacco can cause cancer in lungs, esophagus, larynx, stomach, bladder, kidney, etc. What happens when you smoke/consume tobacco is that when you inhale or consume the smoke or material, the carcinogen present in the material goes into your body. And when your body absorbs those harmful chemicals, cancer is caused. Another harmful factor, which is also quite infamous for causing cancer, is radiation. Radiation is one of the sneakier carcinogens, as you might not even know you're getting exposed to it. Radiation is a type of carcinogen known as mutagen, which mutates your cells into cancerous cells. Radiation is also caused through the environment with constant exposure. Thus, there have been cases of cancer through radiation near nuclear power plants and houses near cell towers. Moreover, your daily handheld devices such as mobile phones, portable gaming devices, etc. can also cause cancer, although the chances are very low due to the intensity of the radiations. There are mainly three ways of treating cancer in conventional medicine: chemotherapy, radiation, and surgery. Surgery is simple and clean. Cut out the tumor and hope that all the malignant cells are cut out. Although the method is painless and effortless, it does have many limitations. Surgery can only be performed if the tumor isn't on any vital organ and doesn't hinder the person's life, meaning that surgery can't be performed on patients in the later stages of cancer. Furthermore, surgery may or may not take out all the cancerous cells, which means that it is possible to find cancer in a person who has gone through surgery. Chemotherapy is one of the more effective options of the three, but it is also a lot more painful to go through. Chemotherapy makes use of chemotherapeutic agents which given in a standard regime. Chemotherapy focuses on genes which divide rapidly and kills them. Targeted chemotherapy is used for cancers which require more concentrated attention and also help the patient's well-being as it doesn't affect the whole body. The problem with chemotherapy is that it causes a lot of problems for the patient: headaches, vomiting, and cramps, just to name a few. But there is also another method called radiation. Radiation shrinks the cancerous cells, but the problem with radiation is that it also kills the cells which are not cancerous. There are other non-conventional treatments available such as homeopathy or Ayurveda, but they aren't tested products and are more risky to use. Although cancer is a labyrinth, there are people who are working for a solution. Scientists have made tremendous progress in finding about the disease and its cures, with new drug trials being launched every day. It is very much possible that one day we will live in a world cancer-free. Even though scientists have made tremendous progress in making treatments and cures for the disease, there have been many cases of it, and this documentary focuses on the emotional impact the disease left on the survivors of the disease and also the people who fought the disease with the survivors. Suman Arora was a cheerful woman and had obtained a degree in physics. She had known that there was a growth inside her for 12 years, but she was worry-free as the growth had been declared as a germ cell, that is, cells which cannot grow cancerous. But in 2006 is when the problems started to arise. The problem named cancer.
I used to think I'm free of cancer. Whatever had occurred has already gone out. Still have to undergo chemotherapy. It was a dreaded name. It was.
How did the chemotherapy affect your life?
वो बहुत गंदा था. Chemotherapy initially I thought I'll carry because I was very positive and bold and gutsy person I am by default. तो initially तो I was very prepared. ठीक है अब जो होगा देखे जाएंगे. But whenever it came to me that okay I have to take that poison inside me, all time I thought अरे बाबा मुझे नहीं है cancer, don't give me. But I had to get administered. I loved myself. I just said, please God, whatever happens, let me not lose my that positive attitude towards life, or the way I am chirpy and bubbly and very positive towards it, and let that not die. But I think that was also affected early on. That also got affected. That was partly because suddenly I felt I was all alone in the whole world. Nobody could help me, and my journey is now all alone. In the whole universe, I'm alone, heading towards maybe death or whatsoever. My journey is alone. That loneliness was too much. Suddenly I thought something again inside me said, okay, recollect whatever. Maybe my end is near and I have to recollect whatever I was always wanting to do in my life. So one thing that surfaced, that I had always been, wanting to do law, a degree in law. Though I was postgraduate in physics earlier, but somehow after marriage I had always thought that I'll be doing law sometime. Lost my hair, I had to wear a wig. That was again, I was very apprehensive. Somebody would maybe accidentally tears it off and I will be exposed. So many challenges were there. What transformation my psyche has gone? Yes, I have. I've become little. अभी तो थोड़ा सा अगेन बैलेंस हो गया है, पर पहले मुझे लगता था मैं बहुत ज़्यादा काइंड ऑफ रिवेंजफुल हो गई हूँ और नॉन फॉरगिविंग हो गई थी.
So, how did this attitude of yours affect your social and personal life?
Again, I told you, only because of law some people could take it. That probably because of law she has become so.
The stress and
everything.
When did you feel you were back to your old self, or are you still working on it?
I'm still working on it. Even after 7-8 years, I'm still working on it. I'm not, though those wounds have healed, and I'm almost back to normal, but वो disenchantment जैसे निर्मोह करना, मोह को हट जाना, वो that has become permanent.
What we can see in her case is that although she hardly went through any cancer symptoms, the treatment of the disease was the phenomena that caused all the uneasiness. And this uneasiness is what finally caused the change in personality and the outlook of the world, which shows that even though the disease might be non-existent, the treatment itself is a very traumatic experience. Now let's look at a very different case. Surinder was a vendor and was leading a happy life when he was diagnosed with tuberculosis, a relatively deadly disease. After consulting a few other doctors, it was found that the disease he was suffering from was in fact cancer. He was rushed to Safdarjung Hospital shortly. तो आपको कब पता चला कि आपको ये कैंसर नाम की बीमारी है?
सर 2011 में पता चला. वहाँ जहाँ रहते थे हरिनगर, वहाँ दिन दिया में दिखाया, 3 महीना वहाँ दिखाया. उसके बाद जैसे वहाँ टीवी के जाँच पूछवा तो डॉक्टर ने टीवी की अति कर दिया कि टीवी है. टीवी की दवाई चलने लगा, 2 महीना चले, फिर अब तेज हो गया. बस टीवी नहीं ठहरा. फिर उस पहचान के बड़े डॉक्टर ने उनके पास गए. फिर और जब देखे तो कहीं नहीं, इतना टीवी नहीं, तुम भागो जल्दी से यहाँ सफदरजंग जाओ. कभी सर ऐसे फिर कल इधर इधर दिखाओगे तो पैसे लग जाएगा, तुम मर जाओगे, बच नहीं पाओगे. सर कहाँ जाओ? सफदरजंग जाओ. सर फिर रेफर कर दो, कहा वो रेफर कर दे. फिर यहाँ आए. एक ही साइकिल जब चढ़े, पहले के बेर चढ़े, एक ही रात में मेरा दर्द पूरा आसान हो गया. उसके बाद 8 साइकिल चढ़े तो मैं सही हो गया था. फिर इधर 14-15 में आकर फिर मेरा तबीयत खराब हो गया. उसके बाद 12 में 12-13 में आकर मेरा पेट हाथ फट गया. फिर
पता चला कि आपको ये बीमारी है. आपके मन में क्या चल रहा था?
अब मन में सर क्या बताओ, तो हेडक तो हर आदमी के होते हैं कि नहीं बच पाऊँगा, ये है वो है. तो मेरे से ज़्यादा तो बच्चे घबरा गए सब कि आप नहीं बच पाएंगे, पापा नहीं बचेंगे, ये हो गया वो हो गया. कोई बता कहना लगे. अभी तो अच्छे जब दवाई चल रहा है, इलाज चल रहा है, तो सब सही चल.
अब आपकी ज़िंदगी
बना रहे हैं, जब तक चल रही है ज़िंदगी सही है.
और ये जो दवाइयाँ, ये कैंसर, ये पूरी जो बीमारी है, आपके मन में कोई बाधा दे रही थी कि क्या होगा मेरा, क्या करूँगा मैं? कुछ हुआ था आपको ऐसा?
ऐसे सर तो बहुत बात होते हैं कि मैं क्या करूँ, मतलब लास्ट एक ही पोजीशन में था कि मैं अब बचूंगा नहीं। मेरा एक ही सलाह था कि चलो कोई बात नहीं, अब बच्चे के समझा रहे थे चलो भाई, इस बीमारी में तो कोई हर आदमी कहते कि बचते नहीं है, कैंसर बीमारी ऐसी है।
In this case, what was interesting was the fact that the patient himself was saying that death was imminent. But it was the family's support that helped him get the will for fighting and gave him a reason to live, a reason to get better. But what if your family, siblings, and parents included did not support you, banished you, and didn't even care what happened to you? Similar things happened to an old lady named Champa Devi.
अच्छा, तो अब आपको कब पता चला कि आपको ये बीमारी हुई है, कैंसर नाम की?
हम डॉक्टर से दिखाए थे, रांची में दिखाए थे। यहाँ पर छाती में ना मेरा गांठ जैसा हो गया था।
अच्छा अच्छा।
ऐसा मेरे पास नहीं है, फिर हम टाटा चल गए, जमशेदपुर टाटा में, वहाँ जाके फिर इलाज करवाया, तो वहाँ मेरा इलाज हुआ। हाँ, वहाँ इलाज हुआ तो वहाँ 6 महीना मेरा इलाज चला है, केमो लगा हमको। वहीं के डॉक्टर, अमित डॉक्टर देखे थे हमको।
जब आपको पता चला कि आपको ये बीमारी है तो आपको बहुत दुख हुआ था?
हाँ, बहुत दुख।
जब आपकी ये कीमोथेरेपी चल रही थी तो आपको आप कहाँ पे कर रहे थे, कैसे कर रहे थे, और क्या ये कीमोथेरेपी आपके जीवन में कोई हानि की थी?
हानि तो कुछ नहीं की, खाली आँख का रोशनी जो है ना मेरा थोड़ा सा कम हो गया।
आपके परिवार ने आपकी सहायता की?
कोई नहीं सहायता भैया, कोई नहीं किया, अकेले मैं करी। टाटा भी गई हूँ अकेले, यहाँ भी अभी अकेले आई हूँ, अकेले ही चल रही हूँ, कोई मेरा नहीं है आगे नहीं पीछे।
This shows that how, against all odds, you can still fight cancer. This lady had no one to fight the disease with her, no support at all, except of the doctors, which goes to show that how much self-determination is required to go through cancer and its treatment. And in this case, it had to be done all alone. Although there are many more cases which are very horrific, there are cases which have a rather better experience with the disease. Senthil Chengalvarian is a journalist. For some time, him and his wife were observing a swelling in his thumb. For a year, it didn't seem to affect them. But suddenly, the swelling started to grow rapidly. When were you first diagnosed with cancer?
Okay, we got the first diagnosis that it was cancer on April last year, April 6th, and about April 7th actually last year. We got an email from my doctor who is in the US, because we had sent him a biopsy report. Earlier, we had the biopsy report in India. They told us it was not cancer, that it was another kind of tumor, benign tumor. So this doctor made it very clear that we've got it in an early stage. Yes, it's bad news that it's cancer, but good news is that it can easily be cured by amputating.
Did this amputation affect his life in any manner? Or does he feel the need?
I'll tell you. So, what happened was, when the surgery was first done, he had a huge bandage till here naturally. At that time, so you didn't even know that your finger was not there, because it was like a thick, big bandage in the hand.
Right. So when the thumb was initially cut, right, for the first few weeks or days, did he face any psychological problems regarding because his after all it's a thumb he's missing?
I would not call psychological problem, but yeah, the thing is,
So he was saying that
I won't say psychological problem because the thumb had gone on like that. But yes, I do remember that it was a big scar and so on. So I do was little reluctant.
Here, the emotions of both the patient and his wife was calm. This is majorly due to the fact that the cancer was caught in its early stages and did not pose a deadly threat. Although this cancer was a rare one, it was one which could be cured easily, and certainly losing a thumb is a small price to pay for a life. Now that we have looked at the patients and their families, it is important for us to look at the people who cure, the doctors. Dr. Kapoor is a general physician who specializes in geriatric, which is the treatment of old people. And although there are success cases, deaths of some patients are eminent.
You must have had patients who you had to deal with and tell them that they have had cancer. So, how does it feel when you have to do that? Do you feel sad for the patient?
You mean breaking news to them?
Yes, that they are ill, they have cancer.
Yes, it's sad. Of course it is. Because you're almost giving them a death sentence.
Okay, so when you have a patient who is terminally ill, who has cancer which cannot be cured, and is it tough to treat a patient who is terminally ill, that you know that he can't go any further, he has a limited time left in this world?
Okay. So that depends on two things. How prepared is he to meet the consequences? And secondly, does he know it well that he is that sick? Our attitude turns more toward the technical component of it.
Mm-hmm.
The saving the life issues change to just prolonging the. See, loss is a bad news, of course, and it's uncomfortable also for us. But then it's almost like somebody is marked to be taken away. So when you understand that, and then all our attention gets diverted to somehow relieving his misery and somehow prolonging his life, his or her life.
So, do the patient's deaths affect your personal life?
Yes, we are a bit gloomy for a day or two. But then, as you said earlier, there's a learning curve. And initially we were very shocked for say when we started our practice for 2, 3, 4 days, we were a bit upset. But now gradually, as perhaps even we have matured, or perhaps we have seen so many of them, that we say, okay.
I'm sure you must have had patients who you actually personally knew or connected with while you were treating them. So, and when you had to lose them, what was your emotional status? How did you feel?
See, sometimes we are almost angry, on ourselves or everything else. That why did the patient delay his symptoms till they spread or till they.
Do you think the Babas and the Sadhus and sons, they actually make effect on the patient's curing or the healing process?
They are very cruel. They don't know an iota of what's going on. They don't know the diagnosis. They don't know the pathology, anything. But then they claim. And I think that is playing with the
patient's
life in terminal is very, very cruel. All they do is make some pudia, they give a mega dose of steroids or something so that the patient feels better for some time. And eventually, when after say whatever time they treat, a week, a month or 2 months, the patient comes out of them, goes into a worse phase, they sort of give him up. That they are very cruel, and I think they're the worst human beings possible.
The point to note here is the frustration a doctor feels when the patient opts for useless ways of treating cancer. Ways that will never work, which are the Sadhu Babas and other entities which can cure cancer. As rightly said by Dr. Kapoor, that the patient's life isn't a thing to be played with, but these sadhus are doing just that. When you're well into your career as an oncologist, you will have faced death, and so has Dr. Nandi, a well-trained clinical oncologist who is well into his career as a doctor. He has had many patients throughout his medical life and has also faced death. Here is what he has to say.
If the patient does not know about the disease, then it is very difficult to manage such a patient, because the treatment for this disease causes a lot of side effects. Many people die without doing a will because it was not disclosed to them. So these problems crop up if they do not know what the disease is, what the prognosis is.
So when all this happens, so how do you feel? Do you feel frustrated at the patients, or do you feel really sad for the patients' lives?
I mean, those kind of emotions on my part used to come in the beginning of my career, not now.
So how hard is it to treat a patient who is terminally ill?
Technically speaking, the most difficult aspect in managing a patient of cancer is dealing with their expectations of getting cured. Okay? By this, two sides of the coin have to be looked into. One is a patient who is very likely to get cured, but is inherently having this notion that, okay, I am finished. Now these patients tend to take wrong decisions for themselves as far as management is concerned. Many patients do not say, मैं तो मर ही जाऊंगा, क्या इलाज कराना? Okay, that's the negative part. Then you consider a patient who is not going to get cured. So making him accept that, you should see to it that in providing for that management, the family should not get bankrupt. They immediately seek medical advice, and then when the larger family members, they come to know, some advices go to Apollo, some says go to Chennai, some say, so the immediate family members, they get confused many times. So that can lead to taking decisions probably which were not optimal for their patients, one. Second, in our society, many families, they hide the facts from the wife of a male patient.
Do the patient's deaths affect your personal life in any manner?
No, not deaths in particular. But for any doctor, patients do affect their personal life. You cannot segregate that totally in a system like ours.
What we see is that the family want to support the patient, and in their way they are trying to, might just prove to be a hindrance, and this is a challenge which he has also had to face, but was able to overcome. But also a thing to notice is that the deaths of the patient don't affect the doctor's life as time passes by, until death becomes a phenomena a doctor has to face. Learning differential medicine is a unique thing in itself, but using the differential medicine to cure cancer, now that is interesting. Dr. Kishan is an oncologist who treats patients with homeopathy. The main difference between allopathy and homeopathy is that the homeopathy is mainly oral consumption and much less pain. But even though it is pain-free, it does have limitations.
You must have had patients, many patients, who you would have emotionally connected with, or who actually meant something to you, and some of them you might have lost them. How did you feel after losing them?
Of course, a sense of failure in terms of professional expertise or competence, and grief as well. If it's a personal connection, then obviously there's more grief. There's grief, I think, in loss of any patient. You learn to cope with it better, because in people who are not in a profession like this, I don't believe that they're exposed to death as much as we are. So you get jaded in a sense. which is not always a good thing, because sometimes you have to remember to reach down for your emotions when it's a more. Also, at a professional level, you can spend time re-examining the decisions and advice you may have given, and decisions you may have taken. So that becomes another sort of evaluating if you did everything you could, or perhaps you could have done some things differently. Every decision, personally, it affects, because we are all humans.
And when you lose a patient, do you blame yourself for that?
I don't think, if you are trained at what you do, I don't think there's any concept of blaming oneself.
Interesting point here is that how tough it is to make a patient realize that they have to shift to allopathy, as nothing more can be done here. And though it is tough for the patient, it is also a challenge for the doctors to realize that I cannot do anything more. And also having to convince the patient that they have to move on. Cancer is certainly a disease which has long-lasting after effects, emotionally and mentally. But the problem is the patients aren't the only ones affected. The family, as well as the doctors who also fight cancer with the patient, go through similar emotional trauma as the patient. Although for doctors it does get easier over time. Cancer is a horrible disease with even horrible consequences. But research is being done, and today there are more effective ways to cure cancer than there ever were in the history of humanity. I just hope that cancer becomes a thing of the past as soon as possible.